for the speech. Okay, the next session will be with Dr. Tariq Jagmag. The topic will be Immune Biotechnology, New Frontiers in Immunology. Dr. Tariq pursued the field of psychoneuroendocrine immunology over the past 15 years. He is currently the scientific advisor at Glodema Lab Private Limited, a dermatological pharma company and its sister concern permission to develop low-dose cytokines. He is associated with FOCIS, Federal of Clinical Immunology Societies. He has 2 international patents on his name and is developing new and innovative products. He conducts regular training programs for doctors on immunology, various diseases and their pathways, different cytokines and homeopathic remedies. Please welcome Dr. Tariq Jagmag.
Hi to you all. Good morning.
Good morning.
Let's start today. Can you please play the first slide? Oh, it's there here. How do I operate this? Okay. Dr. Paul, those slides which we had sent you, you haven't put them up, the new ones? Where's Amanda? Can you give the slides to Dr. Paul? Oh, this is quite embarrassing. We have all these slides and we don't have them up. Okay, so while they're putting the slides up, I'll just give you a brief introduction as to what we're going to talk about. So the issue with medicine usually is we take drugs and we just give them to patients based on the disease that they have. If you have hypertension, you just take some drugs for hypertension and that's the end of that. But what precision medicine is that you look at the patient as a whole and you give him treatments that suit his body type. And different people have different ways to understand which medicines are appropriate for the patient. So you can use things like kinesiology. There are so many other methods that you have to be able to identify what medicines to give to the patient. What we are teaching is actually a very different thing. What we are doing is by basically taking proper case history of the patient. Like I explained yesterday, if a patient has severe bloating and burping all the time, that basically means that they have sympathetic stress overload, and for that there's a specific medication that we give to solve this as an issue. Now the patient may come with dandruff on the hair and may have bloating and burping. And when we give the drug to stop the bloating and burping, the dandruff goes away as well. This is because the nervous system, if it's hyperactive, stops your immune response. So these are the things which I'm teaching the doctors, which is known as PNEI, Psycho-Neuro-Endocrino-Immunology. So we look at the patient's mental features at times. We look at their neurological responses, like how their autonomic nervous system is functioning, how their sympathetic and parasympathetic is functioning, how the endocrine system is functioning. For example, if a patient has low cortisol, they'll have salt cravings. So if a patient comes to us and we actually ask him that, hey, do you have salt cravings? He says, yes, I crave for salt. I put a lot of salt in my food. We know that their cortisol is low. If the patient's cortisol is low, he may tend to have hyperacidity as well. So then we ask these other questions to the patient to identify that the cortisol is low, and then we do a specific test to confirm our diagnosis. Sometimes the cortisol may be normal, but the ACTH may be low. The one that triggers cortisol to get released out. And if your ACTH is low, you usually tend to have a lack of appetite. You become quite meek, you become quite mild-mannered, there's no fight left in you. So if you see a patient like that, and we give them another homeopathic to trigger ACTH to rise. Then we go to the immune system. How can you identify what is immunologically wrong by just looking at a patient or talking to them? Actually you can. There's a lot that you can understand just by talking to your patients. So we teach doctors basically how to have these in-depth conversations with their patient to identify systemic problems that the person may have and then give the appropriate remedies. Now, what are these remedies that we are using? We are basically using homeopathics, which are almost like micro dosing the patient. And along with that, we are using certain cytokines which we have developed. What's a cytokine? It's basically just a communication channel between two cells of your body. They could be two immune cells, they could be an immune cell with some other cell. But all the cells in your body are talking to each other through cytokines and chemokines. So we give the appropriate cytokine to the patient in a low dose, which is basically given orally to the patient. Even though it's a protein, it can still be given orally using our technology. And when this is given, it basically allows the cells to start communicating better and remove the disorder. For example, let's say you have an allergic disorder, you have asthma. In fact, my foray into this started because my wife was asthmatic and her asthma specialist himself died of an asthmatic attack. So then I said, well, if the asthma specialist can't treat her, I might as well learn immunology and actually treat her. So if you have, say, asthma, your immune system is sort of Th2 dominant. It's called as Th2 dominance. And by giving the appropriate alternate cytokines, which means that you suppress Th2 and you increase Th1, the asthmatic attacks start to go down. And you can actually get free of asthma. In COVID, we have this amazing little thing that we've made, which is called the antiviral combo. It has certain cytokines which drive your immune system to remove the virus out of your body. So by using these methods, we are able to treat patients. So what I'm going to talk to you about now is the cases which have been done by so many doctors here. So it's actually their cases which I will be presenting, unfortunately, but it's actually all their cases. So we'll start with case number 1. And please bear with me, there are 72 slides, so it's quite a lot of cases. Okay, so this is case number 1. This patient came with generalized small joint pain. The pain is so severe that it wakes him up at night. He's a vegetarian. The hair testing showed that he had low vitamin D and low B12, and also there was some viral infection. He had parasites, molds, spores, and toxic metals with leaky gut. Can you change the slide? Okay. So this was his vitamin D, and this was his level of CMV, EBV, and HSV type 1. If you see, all of them are positive. That means he's got Epstein-Barr, CMV, and herpes. Now you may think that in a patient with arthritis, why are we checking for viral infections? Because these viral infections drive your immune system quite crazy. What they land up doing is, for example, say CMV. CMV infects your vasculature. So in patients with heart failure, hypertension, the moment we start treating CMV, the patient's BP starts to drop and become normal. EBV affects your lymphatic systems, so it causes swelling in your body, fluid retention. So we need to treat these two when we are dealing with arthritis if they are present. Can you change the slide? Okay, so what was the treatment done? There was some vitamin D and B12 given, there was some acyclovir. The CMV and EBV are two meds which are made by us and they target CMV and EBV. There was treatment for parasites done, mold and spores and gut restored nutraceuticals were given. The amalgams were removed. The homeopathic given was Ruta. Now, Ruta is useful when the patient has these small joint pains. So when you have small joint involvement, that's what Ruta does. It's a pretty complicated explanation for how it works, so I'm going to skip that. After 3 months of this treatment, there was no improvement. So they put him on low-dose naltrexone for a month, but there was no improvement. He didn't complain about anything at the time. He had a good life, no problems. He was emotionally stable and mentally stable. Please change the slide. Got it. So basically there was no improvement even though they treated him for viral infections, parasites and mold. Now when he came back, they found that he complained of bloating, GERD. So they repeated his vitamin D, cortisol, ACTH, B12 as he was still complaining about his pain. B12 was low since he was a vegetarian. But here's something interesting we found in him, that he loses his temperature at home. Not his temperature, but basically his temper. He was not sleeping well. He seems to have a lot of anxiety. Okay? So basically what we found now, we are looking at how his brain is functioning, how his mind is functioning to diagnose what is going on in his body. He was having anger bouts. Okay? Now what we did is we gave him that aconite, lycopodium and LSD. The aconite is a homeopathic which works when you have acute bouts of anger, acute panic attacks. So it's like a rescue remedy. If you're having an acute panic attack and you're having tachycardia, if you take aconite, within a minute it will stop. The lycopodium was to fix the high SNS. You see, we were trying to treat his viruses, but because the SNS was so high, it was suppressing his immune system. And they gave him some LSD of mine, which is a low dose one, which helps to basically calm him down. After 2 weeks, he told me that the pain score has decreased from 10 to 2 and doesn't wake up at night with no pain anymore, and his bloating has disappeared. So you see, in this case, all the testing that was done, the EBV, the CMV, the parasites mold, all of them were present, but the treatment given for those did not work because we did not fix his nervous system. So when you're looking at the PNEI approach or the psychoneuroendocrino-immunology, the psycho is number one. So your psychological status or your nervous system controls almost everything below it. The immune system is the last place of control. So if you're trying to target just the immune system without targeting the higher areas of your brain function or your nervous system, your treatments end up usually failing. Okay, this is case number 2. This is of a doctor. Father, who's 89 years of age, came back with 6 bed sores from the hospital. They were not allowed to stay in the hospital due to COVID. He was discharged in the middle of April 22. And the bed sores were initially doing better with the iodine and the duoderm gel. But after almost a month, there was no further improvement. So you can see the ulcer over there. And then this is after treatment. What we did is we gave him this combination of homeopathics. The first one is called as tarantula. It's an excellent remedy for bed sores. If you have a patient with bed sores and you put him on this, it will completely heal the bed sores out. It works by modulating a factor called as Ki67, which is how your epithelial cells use that factor to divide, grow and heal wounds. So we started him on tarantula, calendula, heparsa, gunpowder, lycopodium again, which is your major remedy whenever you have any wound, and silicea. This homeopathic silicea is one that increases a factor called as epidermal growth factor, so stimulates epidermal growth in order to close the wound. He was also given some vitamin C, vitamin D. Daily dressings were done with iodine and the wounds were dressed with gunpowder soaked gauze. So this is actually a homeopathic. We are not actually taking a gun and extracting the powder from it. So the gunpowder acts like an antibacterial, excellent as a topical antibacterial. So the first photo was taken on the 17th, and this was the worst bed sore. The wound was on his partial amputated right foot, as you can see. The second photo was taken on 22/6. Total recovery was just 3 weeks for all his bed sores. We've done many cases in India of sores. India has the highest rate of diabetes in the world, and we also have the highest rate of diabetic foot amputations in the world. So worldwide, it's only about 0.5% of diabetic patients requiring foot amputations. In India, it's 8%. 8% of all diabetics in India have to have their feet amputated. It's quite sad. This is case number 3. It's an 89-year-old male patient who presented with left leg cellulitis, unable to tolerate antibiotics as he was hallucinating with them. As you can see in the images, this was completely red and inflamed. This is day 3 and this is day 5 as the wound is healing. He actually had low-grade fever and we gave him ferrum phos. So there are 2 types of fevers that you can get. One is temperatures below 102, which we call as low grade, and then there are those which are more than 102, which are high grade fevers. Whenever you have a low grade fever which is less than 102, you have to target a certain pathway in your body called the AMPK kinase. So this ferrum phos is the homeopathic which modulates this pathway. So when you give this to a patient with low grade fever, the fever will go. And it's not going because it is suppressing fever, it's because AMP kinase is useful in the treatment of viral infections and viruses inhibit this pathway out. So we gave him ferrum phos, the fever went down in 2 days. His cellulitis appeared on the 3rd day, and if you see, they started him on this treatment, which is basically Cilicia again, the epidermal growth factor, lycopodium that blocked his SNS out and allowed him to start healing. Sulfur is a homeopathic which targets something known as toll-like receptor 2. It is a receptor in your immune cells which helps your immune cells recognize LPS or bacterial LPS. So when the bacteria are leaching their contents out, it is TLR2 which helps to identify it. So you need sulfur to enable your immune system to recognize those antigens. Then we gave him causticum and belladonna. Causticum is another homeopathic that works on the potassium channels. It helps in these channels known as the KCV channels. It basically helps to control blood vessel dilation. So the inflammation subsided in 1 day. On day 2 and 3 there was more improvement. He had a small wound on the left grade 2 which probably triggered the cellulitis, and that too healed. Patient feels much better after that. Now, if you see the homeopathics here and the homeopathics in case number 2 were different. Why are they different? Because the patient presented with different features. Here this patient had redness in the wound, which is severe vascular inflammation. Because of that, belladonna was given and causticum was given. So based on the features of the wound and based on a few questions that we asked the patient, we are able to identify the immune and nervous dysfunction in the patient, which is so cool. Just by talking to the patient, you can understand what's going on at his immune level. This is case 3. This is a nice one. This is a 13-year-old boy who had left-sided persistent headaches for a week. There was no nausea or any vomiting, no aggravating factors. He was very talkative, cheerful. On nerve examination, there was ataxic gait. He had a past history of left-sided retinoblastoma at the age of 3. So the doctor here had referred him to a specialist hospital. A shunt was inserted, and then he was taken for further treatment. He was given radiotherapy, was planned for 3 months' time. However, after being informed of the risk of being quadriplegic because of the therapy, the parents refused to proceed. And they were informed that there is no treatment for the blastoma. This was his condition before. As you can see, the blastoma affected his eye and he was on a tube for feeding. He was then, so the mom came back because he had a cough to the doctor in question. So we gave him a few of the meds, which is basically here. The antiviral combo, as I've said, which works very well for any viral respiratory infection. He was given Ruta again, which helps to dilate the bronchi. And he was given a homeopathic called as Senega, which works in influenza-type viruses. So because we didn't know whether it was a COVID or like a COVID-type virus or an influenza type, we treated for both. Now the cough improved, so he came back for more treatment. So the mom basically asked the doctor that could you treat him for the tumor as well. So he said, yeah, let's try the tumor treatment. So we started him on this combination for the tumor, which is Ruta 6C and Calphos. These two things work very well for brain tumors. So if you have any case with any sort of blastoma in the brain, if you give both of these two, the blastoma does actually shrink and go away. Lycopodium again was given to him to get his immune system back to functioning. The antiviral was given again. An anti-cancer combo is our low-dose combination of various cytokines which help your body fight cancers. He was given CMV, the med that targets CMV in particular because CMV also leads to these cancers. Causticum, we treated him for the fungus, arnica and sulfur to stop his clotting. So this arnica and sulfur we have used very effectively in patients post-COVID who end up having high D-dimers and high CRPs. I'm sure you guys must have seen patients, right? They come with high CRPs and high D-dimers post-COVID. If you give them arnica and sulfur, D dimers of even 10,000, 15,000 become normal within a week's time. So it's quite cool. From time to time, he started to show great improvement. After 1 month on the drugs, he was able to hear again. So this is his condition after some time of treatment. You can see there's no more tube left in his body. And in Jan 22, the MRI revealed he was free from the tumor. His right tube was also removed. So this is a pretty cool case of a retinoblastoma. And this is not the only cancer case that doctors have done. We've done really some strange cases of cancer, including stage 4 breast cancers, we've done ovarian cancers, pancreatic cancers, colon cancers, a whole bunch of them. Okay, let's change. This thing is not working anymore. Oh, it did. Delayed response. Sorry, let me see if I missed anything. Okay. So this is another case. This is a patient, of course, of Bell's palsy, right-sided. Came with right-sided Bell's palsy for a day. She was treated with interferon lambda, causticum, and cadmium sulfuricum. After 6 hours itself, they were able to see some improvement. Now, interferon lambda is very specific for HSV1, which is the virus that causes Bell's palsy. Yeah? Causticum, as I said, it helps to dilate your blood vessels by working on the potassium channels. And usually in Bell's palsy, your blood vessels start getting affected with the virus. And cadmium, we gave the homeopathic form of cadmium because cadmium is one of the toxic metals involved in the formation of Bell's palsy. So these three were given to the patient, and she was able to close her eyes and open them. And this is after treatment, where she's basically become completely normal.